Hello and welcome to another podcast with me, Schizophreniforms, and today we have the rather delightful Mr. Paul Weeden. Feel free to introduce yourself, tell us a bit about yourself, mate.
Hi David, thank you. I'm Paul. I'm a counsellor and therapist of sorts, talking therapies mainly. I'm a member of the BACP, which is the British Association of Counsellors and Psychotherapists. Thanks for having me on the show, David.
That's cool.
I'd like to talk. Thank you. I'd like to talk mainly about the latest area of my work, which is around sort of working with the body and how much information there is when we sort of get in touch with what our body is telling us that we need or that's missing in some way, and that kind of thing.
Can you tell us a bit about your history in relevant fields, sort of like like how did you get into counselling, for example?
Okay, for a long time I worked in the sort of hair and beauty industry, believe it or not. Sort of like looking after people in London and Brighton, and sort of clients really in that capacity. It wasn't really. It's something I kind of found myself in really because I was trying to sort of focus on my musical career really, but I needed kind of money to do that, and I wanted to do something where I, wasn't just sitting at a desk and where I was engaging with people. So what I really got from that was, how to kind of engage with people on different levels and how interesting that can be, and how surprising that can be, and the kind of psychological and emotional responses that we get from people in various capacities when we're working with them I've always found really interesting.
Sure.
So yes, the sort of counselling just came kind of about as a way of kind of carrying on working with people, talking with people, but without the kind of need for a sort of another thing going on, really, I suppose. So,
yeah. But it gave you the sort of flavour for like what it's like to support people and to offer them advice and stuff like that. Yeah, that's pretty accurate. That's cool. So that set the scene for that. And then, so how did you progress further from that? What was your initial stepping point?
Well, I took on some part-time courses to start with over a few years, just like one evening a week, and started learning about Freud and people like Carl Rogers, who's quite a famous humanistic and Fritz Perls, the Gestalt psychotherapist, who very much works with the body and looking at how people's behaviour and mannerisms are affecting them, or
is it similar to like what's it called? It begins with A. Is it a method where like people's bodies manifest their emotional states?
Exactly.
Over time? What's that? Do you know what I'm referring to? The Alexander technique, is it?
Yeah. Okay. Alexander technique. Yeah, that's exactly really relevant to body work, and I think it's William Reich was Freud's. He was the first sort of Freudian to sort of consider this as important, and was kind of sort of rejected for it, and kind of people were saying he was silly and that there was something in it, and it's very recently it's had a real comeback with yoga teachers and Tai Chi and martial arts experts all kind of saying actually there's something in this as well, and it just gets away as well from just talking the whole time about the past or trying to describe feelings, which is it's helpful in some of the time, but sometimes people just can't do it, or for whatever reason, and getting more in touch with what the information in the body is like a really powerful tool, I think.
Sure. Yeah. Is it some in some ways related to indirect? Because like I do tarot reading as like as a hobby, but I don't do it from any necessarily mystical perspective. But like I tend to do it in the form of like it gives someone an ability to discuss indirectly something without ever actually having to state what it is they're discussing, but you can see the results and you can navigate them through that in that way.
Yes, it could do that for certain types of people that for whatever reason find it difficult to either own or just talk freely about how they're feeling, or things they might feel ashamed or embarrassed about. So you might, like, for example, last weekend I was on a shadow workshop in London, and I spent the whole weekend kind of moving around the floor with people, expressing various things, characters from my past, people that affect me, strongly in the current. Sort of trying to
do a lot of developmental work on yourself as well, then.
Yeah, well, I mean, I have to do a certain amount a year, and I'm kind of doing a lot more at the moment because I'm on this bodywork diploma essentially, which is a year long, and it's 5 sort of very long sort of weekends several times a year. And so yeah, a lot of it's just kind of like moving and trying to just kind of express yourself through, or how you're standing, or how you're speaking, how you're holding your body, and looking at using things like the 4 elements model to kind of look at, does somebody have, perhaps...
Was that from sort of what would it be? Western Kabbalic or Judaism or like Wicca?
I think it predates probably. It probably predates like any, label as such of, culture that we imagine. But I think essentially it goes back to China. Really, I think it's the sort of Taoist kind of approach, philosophical approach, I guess. But I reckon it's probably a lot older than that. And but it's a very simple model of just looking at, you start off by just like getting people to kind of move around or just stand, and then saying things like, well, how does that feel to be kind of noticing in your body right now how you are? Is it particularly earthy or watery or fiery or airy? And then looking at
a bit of an insight as to what is there a specific model, like, because with tarot again we have like specific meanings behind the cards, but then you infer additional meaning dependent on the situation. Is it similar in that regard, or is there set ideas of what those things mean?
It's not. It's there are certain sort of agreements that, for example, if somebody was like communicating in a very fiery way, it'd probably be quite aggressive, but it might also be quite assertive as well. It might be quite strong and direct, sort of quite factual but uncompromising perhaps. So you might say somebody like that might benefit from bringing in sort of more water qualities, more kind of softer, forms of communicating more that fluid, might be perhaps more collaborative, fluid. Yeah. So like you might start inviting them to get exactly. Yeah. So you might start to invite them to think about, how would you stand like that? How would you move like that? How would you speak like that? And often at first they'll usually not want to do it, or reject it, or just say, oh, it feels horrible, or I hate it even. And the whole thing is that it's not necessarily about liking it. It's about learning to kind of be with those qualities that are more alien to you, and seeing how that would benefit you. So,
because I've had a similar sort of experience to this with being treated with the voice dialogue technique, if you've heard of that, whereby you embody different characters depending on what physical position you're in, and there's a representation there of, and like they gradually introduce you to parts of the psyche that you've disowned and things like that. And it seems like a very, again, like you said, like body-oriented methodology. Do you find that people can develop new characteristics or new strengths through that then, I'm guessing?
I think so. I think
a bit like a psychotrauma where you enact out how you would like to be, and then it...
Yeah, I think, if you were to use like a really sort of simple analogy, imagine somebody who's like really passive and like, a bit of a victim, maybe they don't take much authority for their, in their life.
Assertive or something.
Yeah, so if you got them, going along and doing something like, say, kickboxing or something 2 or 3 times a week for a year, they might actually not want to do it and might initially reject it. It's really interesting to look at what that journey will bring up for them and how they would engage with others, in similar contexts after that. Getting people who have got, fear of going up high and things like that to actually go like rock climbing or things like that, and seeing how would that new skill, what kind of qualities would it embody, that how would that translate into their personal life, their work life. So it's a really powerful thing without needing to go too much into the past, which is useful to a point, but I actually think it can get in the way if we just keep going on and on about the past all the time, because we can't do anything about it.
It's gone. It's very deterministic.
And it's your version of it as well. It's only your version of it.
It can often be betrayed by like almost like a false memory. Like you reiterate the same point over and over again, and it adds a new context that was never there in the first place. And like
exactly,
I've been treated with CBT and various like psychoanalytical psychotherapy techniques due to my schizophrenia, and like one of the best pieces of advice I was given was when I was discharged from the early intervention psychosis team, which is who was treating me after I first developed schizophrenia, and they said like sometimes just letting the wound heal, just stop reopening it, stop trying to fix it, and just let it heal on its own,
So,
and just learn to get on with things in a certain way like that.
that's right, and that actually brings me to a really good point. So the three sort of basic principles of the type of embodiment I'm learning about is A is awareness. So yeah, just be aware of what is right now, how you're feeling right now, what do you notice going on? Do you like it or not? Do you have any strong judgments or criticism or good feelings about it? And then to kind of like balance your body however you can, so you get your alignment more, you're structurally more aligned, your breathing to kind of help you to sort of balance and ground you in the floor. And then the final one is sort of like core awareness, and kind of like noticing where your core is centered in the ground, and using that to kind of look at, well, what do I really need today? What do I need to sort of do more or less of? What's been perhaps what have I done too much of recently or not enough of? For me,
there's a certain element of like self-reflection within it as well, and like
very much, and looking at what thoughts and feelings come up in the body. So it might be strong. There might be memories there. There might be things that we judge as good or bad, or things that we like or don't like. And just looking at that and thinking, well, what does that mean for me today? What do I need to bring in? What's going to help me feel more centered and more balanced?
Cool. So is it a strictly psychotherapeutic approach, or is there any elements of like psychosynthesis? Because obviously the reason I asked is because there's things like the is it a metaphor you're saying about the earth and the water and the fire, or is there this a spiritual element to the therapeutic approach?
I think both. Would depend on who you are working with. With some people, they sort of almost like reject the sort of psychological side of it and perhaps the spiritual side of it. They might just make it purely about awareness in the body, in engaging in whatever activities you decide to kind of work on, and not really explore, what the meaning is, or whether there's any sort of like esoteric or spiritual dimension to it. I mean, other people would say, well, actually, it all comes from spirit, and I think it's really important to really at least be inquisitive about that, and to ask questions around what that might mean for you personally. Some people might link it to past lives perhaps, or more kind of energy based medicine or holistic healing generally,
or like literalist Tai Chi, things like that, Qigong.
Yeah. I think the main difference between the easy assumption to make is that it's like, so saying, okay, so David decides to take up playing tennis again, like he used to when he was growing up, and that's great because he likes tennis, and then he just goes and plays tennis, and nothing really changes. It's not just about playing tennis. The tennis would be a vehicle for for understanding what his body, what his life is trying to sort of communicate to him, with him, through him. And so noticing what it feels like when he plays tennis a particular way, how the racket feels, like how that might translate into other areas of his life. So it gets quite sort of abstract on one level at this point. People might say, well, how the hell can playing tennis have anything to do with my office job or my difficulties with my family? But actually, because it can have loads of, because you have to constantly move and negotiate through life, just like you do in a game of tennis. Yeah. So
I can see what you mean, but if you wanna like elaborate a little bit more, like give another example of that, how that sort of might manifest in a treatment process, like how someone might like. Because what occurred to me, I was thinking like, I'm by nature, like always, because of the schizophrenia primarily, tend to have a narrative that's quite metaphorical. So it's quite easy for me to imagine, but for someone that doesn't necessarily have that kind of correlation, if you could give another example.
Okay. All right, so I'll give you a sort of typical example of, say, the kind of person I might work with in this way. Say if I've just met them. So we would start by perhaps just like looking at posture and how this client stands, how they communicate, how they move around the room, and then I'd ask them to if we imagine each wall has one of the 4 elements on, so I'd ask them to move in the room to like where they feel that they are closest to, where's true for them the most. So they might say, well, I'm quite fiery, for example, but I'm also really watery as well. So therefore they might stand almost centrally in the room between those 2 points. And they might lean slightly towards, say, an air as opposed to earth. So they might then, from that, we might then decide, so are you saying you have a deficit slightly in earth? And if they said yes, then we would have a chat about, so how could you...
Because I just wanted to make a quick point. That's a lot how my tarot process tends to work when I do that, when I do tarot reading for people, is like, you present an image, and then they naturally ascribe their own mental state, even if it's just at the time. They can ascribe that to the image quite easily because it's a visual image and it's a symbol.
That's exactly right.
Yeah.
And it can change over time. It could change by next week or next day. You might decide, actually, I'd overlooked something and I need to consider this more. So actually it's changed slightly. It might be that some people say, well, actually, I've kind of got all the 4 elements in my life fairly well. I want to just integrate and balance them a bit better. So then we would, kind of look at how would you bring in these qualities that you're looking to embody more into what you currently do. So they might say they do gardening and they do perhaps they got some kind of desk job or something. So how could you perhaps bring some shift in quality into what you already do? Sure. And if you can, or whether you can or can't do that, you'd also think about, well, and what would perhaps you bring into your life that you currently don't do, maybe you've never done, or you've done little of, or you'd like to reintroduce. And and then that would be really about making a commitment to at least a couple of times a week. If it was, say, going back to sort of tango lessons, or you might be learning a language even.
It could be painting, for example.
Can be painting, very much so. Musical instruments, absolutely.
Yeah.
All that stuff, really. Cooking, just about anything really, where you can have a really sort of felt sense within your body of, like, you could be cutting up food, really noticing how that feels, how the flavors smell to you. It could be in a yoga class, just noticing how uncomfortable it feels, how difficult it is, how embarrassed you feel, and then over time just developing a sort of new sense of self through that felt experience.
Okay, it sounds really interesting. Like, so for anyone that's watching, like, how would they sort of pursue this sort of interest? If it was something if this kind of therapeutic approach appealed to them, where would they go? Obviously, to yourself, but like, is there something? Is there like resources on the internet that we could sort of reference to, and like things like that?
I would look up the work of Paul Weeden, who is a American Aikido master who runs workshops on this kind of work, and I'm hoping to.
What's Aikido, by the way? Is martial art?
Aikido is a fluid sort of non-aggressive kind of martial art, which really helps teach people kind of balance and cooperative kind of leadership skills. Sure. In under stress, in challenging situations, how you can navigate and negotiate your way in or out of a situation without causing very much damage.
Sure,
that's the crux of it, really. But
so almost like a non-violent martial art, like a not passive, but like
I'm going to send you a link to his website, actually.
Okay, I can put that on the
It's kind of the guy who's kind of had the biggest say in recent times in the West, and so look me up on yourspacecounselor.org.
Okay.
So I'll be putting up a new website in the next few days. It's almost finished. It's going to have a lot on it about this kind of work. I feel very passionate and excited to be introducing. I'm going to be running workshops. Eventually, I'm going to be running some retreats, various places. So,
could you tell us a little bit more about that sort of idea?
Yeah, sure. So the best way to do this kind of work is in a workshop environment with more than, I'd say, 3 or 4 people, because there's so much more information in the room about each other, and also because they're not all like the therapist. It's not as kind of intimidating as in I'm the expert and you're not. And if it's just me and one person and the other person is the client, then if I'm being invited to sort of feedback all the time, oh, well, you seem like you're quite fiery, and they're like, oh, well, no, I'm not, and you're getting me wrong. It's not that helpful. Whereas if you've got a group of people, you can sort of ask for feedback from different people and get different information and give different information to different people, and I think it's easier to accept, and you learn more quickly about yourself in a less defensive way.
Sure, I can see that.
I say there are exceptions. There are types of people I would choose to only work with one-on-one for various reasons, but generally speaking, say most people get on better in this environment, and it's really great fun, and you get to try out all kinds of sort of floor exercises, kind of games around sort of centering or losing balance with each other, trust, where we kind of lead each other around the room or gently push or pull each other in certain directions and see what your trust is like. Look at gently how you respond under pressure to, like, say, a basic arm grab or something like that. All with consent, all with, kind of, you can stop anytime you want. And, it's really good fun.
Okay, and then, so, like, just to, as a slight sidetrack, like, what introduced you to this concept in particular, this exact therapeutic approach?
Okay, so I met a guy called Mark Walsh, who lives in Brighton as well, at a suicide intervention workshop about 6 years ago.
Yeah.
And we were both participants, and I just followed him on Facebook since then, and he has often posted interesting and often provocative posts, which I find interesting. Sure. And and I sort of just kept in touch with him in quite a casual way, really. And this year I started to express an interest in perhaps taking on the Embodied Facilitator course, and I was really pleased when he asked me if I wanted to do it. So it felt like the right thing for me to do, and I'm really glad I'm on it now. So yeah, that's kind of how it all came about, sort of quite synchronistically, I think is the technical term.
Indeed. So a natural flow.
Very much so, without any force or great effort on my part, just going with what's coming along and finding a way to make it happen, really.
Cool. So just in regards, because I asked you earlier about psychosynthesis and the spiritual elements that some practitioners of. So what was the technique exactly called? I've forgotten the name.
It's embodiment coaching, really.
Embodiment coaching. Cool. I just thought I'd clarify, because I don't know whether we actually said that exact thing. But so some people take more meta approach. Some people take a more Western analytical approach. Yeah. So. Do you mind me asking about your own beliefs and how that impacts on your kind of perspective on the therapy, or even just your own understanding or your own experience, and how that shaped how you would practice? So
for me, I've kind of lived with a certain amount of sort of discomfort in my back, mostly in my lower back, and
was that from an injury or?
Well, this is it. I don't 100% know. I think it's partly possibly from one or two physical injuries. I think there was a snowboarding accident about 15 years ago it didn't seem that bad at the time, but maybe I twisted my spine worse than I thought, and then sort of landing on my head as a kid, quite heavy, quite hard, sort of full body weight as a very small child. So there are a couple of things I can think those things probably didn't help. There's also some, sort of more grayer area, kind of emotional stroke physical trauma in sort of school situations as when I was growing up, that I guess we'd label some form of abuse now. And I think learning about that is that those kind of memories get embedded in the body in some way, whether you remember it or not, and there's a really good by a Dr. John Sarno called The Body-Mind Divide.
I think you sent me a link earlier, actually. Yeah.
Mind-body divide, something like that. And what he talks about is how physical pain can be a distraction from trauma or memories that we want to repress. And the reason why he says this is because with all of the physical ailments that on the whole that people experience as adults, they're often like, oh, I've got a bit of a dodgy knee, or my arm hurts today, but when they're not hurting, you just go out and play, you know, tennis or football again, like it's fine. You go, I'm having a good day, and off you go. Whereas when you've got a real physical injury, like, you know, a fractured arm or something, you can't go and do that. Even when you know it's getting better, you can't do that. Your body tells you you cannot play tennis yet. It's still healing. You don't have the strength. You're gonna have a serious injury if you try and push it.
Sure.
Well, with this kind of stuff, it's what they call TMS, tension muscle. I can't remember the last bit, but it's basically suggesting that the nerves are firing and causing a sort of generally sort of quite a sort of low level kind of pain, discomfort. That's not it's not a physical pain really. It's more of an inflammation.
Partially psychosomatic.
It's partially psychosomatic, partially like sort of there's like a information coming from the nerves or from the from the joints that's telling the brain that there's discomfort there, but it's not the same as when you actually have a break or
some more severe injury,
sprained ankle or something like that. It's not. We know the difference. We've all experienced that difference.
Sure. Because one of the things, I don't know if this relates, but like I found because I fractured my left collarbone when I was, I can't remember exactly how old I was, but I was like early teens, maybe even younger than that. And still to this day, I only feel comfortable sleeping on my right hand side, and there's a lot of associated trauma. And when I sleep on my left hand side, that kind of conjures back memories of like sleeplessness, and it creates a sense of agitation. Is also, I don't know if that relates, but there's so many kind of things like that. Yeah.
Definitely, yeah. That's a good example. So that was. I started to get interested in that a few years ago, and then started sort of playing around with the idea and noticing how much when I committed to doing my yoga, 2 or 3 times a week for an hour, how much better I felt, and how and also how when I sort of found the strength to access more difficult memories, how the pain would actually subside as well. And how, because once you've accessed the memory, you don't need the pain to distract you from it so much. So,
sure, similar in partially. I don't know whether this is accurate, but similar to how people develop trauma dissociation. It's kind of like a physical dissociation. It's like so rather than a block in the psyche on memories or events, it's a block in the body that triggers that same sort of thing. Because I have tics. I tick a little bit when I have because I suffer from OCD as well as schizophrenia, and I have a little tick where I might shake my head when an unpleasant thought enters, and that tick was never prevalent until I developed the OCD, which was a reaction to schizophrenia. Is it similar in sort of that kind of way? Or?
How do you find the tick helpful?
It's literally it started out as me deliberately moving my head, and now it's an automatic response where if I get a traumatic or particularly intrusive or abusive thought, which is quite common in both OCD and schizophrenia, it happens automatically now, and it sort of just switches me. And I also have things like safety first is one of my words I say, and there's various other things like that. And I've got lots of things, because I was taught neurolinguistic programming when I was in therapy when I was about 16, because I was diagnosed with severe clinical depression. And they taught me how to reprogram my own internal narrative and dialogue and stuff like that. I forget what my point was. And this was kind of like a physical manifestation of that process. I sort of allowed it to happen, and then over time now it just happens automatically. I'm not even conscious of the thought, but now I have a tick, which is actually a guise or masking the issue of not being able to deal with intrusive thoughts. So.
Or it might be a way of discharging the sort of that energy from the body as well, like when people sort of do, I don't know if you know about tapping or acupuncture, where you sort of break through the block, if you like, wherever it is, and then that releases that trauma or that discomfort, back into your circulation again, or partly back out, perhaps into the ether, if you like, as well. So maybe people develop these things as a way of discharging for themselves, So it's like a ritual.
Well, it certainly feels like that. It feels like there's something rises and I just dismiss it and it's gone. Oh, I just whacked my headphones. But it's an autonomic response now almost. It's automatic, and it's my way of not allowing that energy to consume me, because with schizophrenia and obsessive thoughts especially, from OCD, which I developed to control the schizophrenia, I found that like I could use artificial OCD, hijack that OCD to create a certain thing in my psyche, and it's sorry, it's hard for me to talk about it, but yeah, you get the idea of what I'm saying. So my next question, I had a question. That's probably why I'm struggling to focus. Would you be at all open to discussing further, like, is there any spiritual grounding or like any complementary practices and things like that, and your own belief systems and how they've informed?
I was coming to that. So I think, you know, a lot of things that we're taught through, you know, religion or mainstream sort of spirituality generally, like, tends to sort of see the body as a sort of brain taxi, and you know, it's basically a bit of meat that's
meat
sort of
puppet,
meat puppet, sort of you carry around. And you shouldn't give it too much attention. You shouldn't be too, like, you know, you know, sort of serving in a way, or you shouldn't give yourself too much attention. Like, you know, that would be vain, or that would be a bit narcissistic, perhaps. Like the idea of actually, you know, really indulging in how your body feels for an hour every day, and like through meditation and yoga, it would be sinful to perhaps some Catholics, or you know,
even some like more purist Buddhist practitioners as well would find the idea of the concept of focusing on anything
that's not external, but actually I think the opposite is true, because actually by taking care of the body and what it's trying to sort of teach you, you're actually improving the lives of others through feeling better in yourself. And, you know, maybe there is some kind of you know, very unquantifiable kind of, you know, process that's going on that might be linked to your, you know, your soul purpose, if you like, or some kind of historic you know, past life.
Sure.
Who knows? I mean, so I think what's important is that's really, really interesting and great. You know, kind of look at that if that's what you find interesting, but follow the information as well, and don't question it too much. If it leads you towards, you know, making, you know, cakes or doing something that you just wouldn't possibly have imagined, just go with it anyway. Like, just do it. It's trying to tell you something, and there's probably some silver lining that you can't possibly imagine at this stage.
What was I thinking of in regards to that? So, like, hold on, brain. No, I've forgotten. Sorry, brain went dead for a second there. Right, I need to have coffee, so I think this is a good time to stop, because my brain's really empty and I'm really tired. Okay. But thank you for coming and talking to me, and we can always do this again, and maybe if you want to try a session, David, maybe you could come and try that, and then maybe you could talk about it on your channel again, maybe after you've done that. I'd love to do that. Yeah, no, very much be intrigued. Right. But yeah, I shall have to depart at this current juncture. So thank you very much. Thank you very much. Having me on, David. It's great to talk to you as well. Always a pleasure. Take care. See you soon. Take care. Cheers. Bye bye. Bye bye.